We usually eat meals and absorb them as nutrients. We convert it into energy and live. It's important to convert the sugar taken from this mouth into energy. Thank you for watching this video at YouTube Medical University. This time, it's about diabetes. Diabetes is actually a condition of the body that is hard to notice, but diabetes is actually sending out various save our souls signs, and if you ignore them, it can be life-threatening. Here are 7 surprising and dangerous signs of diabetes. 1 in 6 people reportedly have diabetes. Some individuals are diagnosed with advanced diabetes, leading to amputations, the need for dialysis, or near vision loss. I have experienced this. The scary thing about diabetes is that even though there are initial symptoms, they are not bothersome enough to notice until really troublesome symptoms appear, at which point the disease has usually progressed to a point of no return. Therefore, this video is made to help you check if you have the symptoms I will introduce next, and if these symptoms appear in the future, you can detect them early. Sometimes you feel different, but it's not a big deal. To avoid a difficult situation, please listen until the end. If you're watching this, you likely have a strong interest in health or may have diabetes. YouTube has a variety of content on this topic. Many medical professionals are posting videos. There are many things that are easy to understand, but what is said in each video can be different. There are also ones that list symptoms, and there are some that are disseminating incorrect information. So this video explains why those symptoms occur and in what order they occur. I will explain it in a way that is easy to understand, even including the structure of the body. The video will be a bit long, but I want you to be able to think about your own health and avoid incorrect information so that you won't regret it later and can choose the information you need. With that in mind, the first thing I will explain in this video is the structure of diabetes in a way that is easy to understand. Then the second thing is the 7 dangerous save our soul signs of diabetes. I will explain them in order of appearance, divided into 3 parts. So how does diabetes progress? Diabetes is a disease where sugar comes out in the urine, right? That understanding is incorrect. Even if sugar is not coming out in the urine, there are many people with diabetes. Understanding diabetes, the most important thing here is insulin. We usually eat meals and absorb them as nutrients. We convert the food we take in from our mouths into energy to live. Insulin is crucial for converting these sugars into energy. Insulin is famous for lowering blood sugar levels, but it does so by utilizing sugar for energy, which reduces the amount of sugar and lowers blood sugar levels. This is because the function of this insulin deteriorates. The sugar doesn't get converted into energy, so the sugar increases and the blood sugar level rises, leading to diabetes. This is because the body can't utilize the sugar for energy, leading to an energy deficiency in the body, and various bodily dysfunctions occur, which is diabetes. So how does insulin function deteriorate? The most common cause is obesity due to overeating. Why does storing fat in the body deteriorate insulin function? Therefore, the blood sugar level rises and leads to diabetes. If you understand insulin, it's easier to understand why you get diabetes. However, that's not all there is to it. I think there are people who have heard that diabetes can be inherited. In fact, if both parents have diabetes, the probability of their children developing diabetes is said to be 5 times higher. This is thought to be due to the inheritance of a constitution where insulin is less effective from parent to child. Inheriting this constitution doesn't guarantee diabetes development. However, those with this constitution are more prone to poor diet, body fat accumulation, and further insulin effectiveness impairment. This increases the likelihood of developing diabetes. Do you know about type 1 diabetes? Even if their diet is not disrupted, some people develop diabetes due to heredity from their family. The term diabetes itself is often misunderstood by the general public as a disease caused by a disrupted diet. However, those with type 1 diabetes do not develop the disease due to a disrupted lifestyle. So I would like to clear up such misunderstandings. Regardless of the reason, whether it's obesity or heredity, the effectiveness of insulin deteriorates. When the effectiveness of insulin deteriorates, it becomes impossible to utilize sugar as energy, so blood sugar levels rise. If this state of elevated blood sugar levels continues, it is diagnosed as diabetes. It's a bit of a difficult story, but if you understand this flow, it's easier to understand the symptoms of diabetes. Symptoms caused by high blood sugar levels, symptoms caused by becoming diabetic and the state of high blood sugar levels continuing, and symptoms caused by poor insulin effectiveness. If you think about these 3 symptoms, it's easy to understand the order in which they appear, and it's easy to organize. What everyone is concerned about are the symptoms that appear as early as possible. With that said, I will explain the 3 choices of symptoms that are likely to appear early due to high blood sugar. The 3 choices of symptoms caused by high blood sugar levels. The first one is dry skin. Those who thought that dry skin is a symptom of the skin, what does this mean? The human skin has blood vessels running underneath it. A lot of sugar is contained in these blood vessels. In such a case, due to osmotic pressure, there is a function that draws the moisture of the skin into the blood vessels. Therefore, when blood sugar levels are high, the moisture of the skin is taken into the blood vessels, making the skin prone to dryness. And when the skin becomes dry, inflammation occurs, called dry dermatitis, and itching may occur. There are reasons for itching other than this moisture. Neuropathy caused by diabetes, and itching due to uremia caused by kidney damage in diabetes, where toxins cannot be properly excreted from urine, may also occur. It's good to be aware that people with diabetes tend to have dry skin and are prone to itching. The second symptom of high blood sugar is decreased immunity, making people with diabetes more prone to infections. Itchy skin, mentioned earlier, is one reason for this increased susceptibility, but not the only one. People with diabetes have a characteristic of being susceptible to infections such as athlete's foot and ringworm due to their lowered immunity. If you've been feeling unwell lately, that could be a reason. This could be a dangerous sign of diabetes. I will explain why the immune system is weakened. In our bodies, there are cells that fight against bacteria called white blood cells. These cells are usually white blood cells circulate in our blood, but when blood sugar increases, their function decreases. This leads to a reduced ability to fight bacteria, making infections more likely. I think it's easy to understand when you know the reason. In short, water fleas, bacterial infections, and bee sting dermatitis can cause red, swollen skin, fever, and require antibiotics. Untreated cases may affect underlying skin. The risk of diseases that can lead to necrosis of the muscles and bones underneath the skin, requiring surgery and amputation of limbs, is high. The third symptom caused by high blood sugar levels is a dry throat or frequent urination. These symptoms are particularly likely to occur when blood sugar levels rise rapidly, so even if you are pre-diabetic, there is a possibility that these initial symptoms will appear if your blood sugar levels rise all at once. Many people may not have heard that frequent urination is a symptom of diabetes. Indeed, frequent urination can be caused by an enlarged prostate in men or in women. The nerves can become hypersensitive, leading to an overactive bladder. These are the most common reasons. The reason why diabetes causes frequent urination is because the amount of urine produced increases. Let me explain the reason. This is similar to the reason why your skin becomes dry. As diabetes progresses, sugar leaks into the urine just because it's diabetes. When this happens, sugar has the ability to attract water due to osmotic pressure. So the water in the body is drawn into the urine produced in the body, increasing the amount of urine. Therefore, because a lot of urine is produced, the frequency of urination increases, and symptoms such as "I've been going to the bathroom a lot lately" appear. And because water is increasingly taken away by urine, the body becomes dehydrated. And when sugar leaks into the urine, blood sugar levels are also quite high, so the osmotic pressure inside the blood vessels is high. Our bodies normally respond by thinning the blood, so it's bad if you don't drink enough water. This causes your throat to become thirsty and you take in a lot of water. Therefore, if you've recently been feeling thirsty and drinking more fluids, it could be a sign of diabetes. And what you need to be careful of is that the brain is issuing commands to take in water, but at that time a lot of sugar is included. If you gulp down sports drinks or juices, your blood sugar levels will rise even more, which is even more dangerous for your brain. Taking in water, especially water that contains sugar, can lead to a vicious cycle where your blood sugar levels rise even more. In the worst case, this can be life-threatening. This phenomenon is referred to as PET bottle syndrome because it often occurs with clear bottled drinks. These are 3 symptoms that are likely to occur when your blood sugar levels rise rapidly at a relatively early stage. If your blood sugar levels stay high for years after being diagnosed with diabetes, you may experience additional symptoms. Dialysis, foot amputation, or near loss of vision may be necessary due to long-term complications from diabetes. These are potential symptoms that can occur. These are the effects. In this session, I will explain the symptoms that occur when high blood sugar levels persist. The symptoms caused by persistent high blood sugar levels are as follows. The second symptom is eye problems. Normally, I diagnose diabetes or prescribe medication to people with diabetes in this way. There are times when I diagnose diabetes in this manner. Doctor, recently I've been having trouble seeing, especially when I look at a white wall. I can see some black spots floating around. What is this? You should consult an ophthalmologist if you are experiencing eye symptoms, especially if you have diabetes. Diabetes can cause eye complications. If the symptoms are diabetes-related eye issues, Damage starts from the small blood vessels throughout the body, and symptoms appear. Why is that? Why does it start from the small blood vessels? There are blood vessels here, and blood is running through them. What we call blood vessels are actually made up of cells called endothelial cells in the walls of each blood vessel. If there is a lot of sugar in the blood, it actually damages the endothelial cells with something called reactive oxygen species. To give you an image, it's like having a lot of sand in the blood vessels, which damages the walls of the blood vessels. Because of this, symptoms are more likely to appear with a little damage to the small blood vessels. The eyes have small blood vessels, so symptoms in the eyes tend to appear early. However, there are many people who have damage but no symptoms in their eyes, so when I diagnose someone with diabetes, I always ask them to also see an ophthalmologist to check whether there is any damage to their eyes. This is because if the detection is delayed, their vision may become irreparable and they may no longer be able to do the household chores or work they have been able to do so far. Vision is very important, as I mentioned earlier. If you look closely, you may notice something resembling floating trash, similar to mosquitoes flying around when viewing a white wall. These are called floaters due to their appearance and movement. These symptoms could also be due to diabetes, so please be aware. Please have it checked at an ophthalmologist. The second symptom caused by prolonged high blood sugar is neuropathy. The second representative of the body's fine blood vessels is the nerve. The reason my body is functioning is because nerves are spread throughout my body, and these nerves are nourished by blood vessels are also spread throughout the body. In fact, the first symptom that appears with prolonged high blood sugar is a nerve symptom. It is said that these symptoms appear 5 to 10 years after becoming diabetic. Symptoms such as numbness and pain in the hands and feet and itching appear. The distribution of symptoms is characteristic, and it is called glove and stocking type, affecting the areas as if wearing gloves or stockings. The symptoms appear from the tips of the fingers and toes, the parts where you would wear gloves and socks. They often appear symmetrically on both sides. Therefore, it's not typical for diabetes to cause numbness in the entire right half of the body, but rather symptoms like numbness in the fingertips or toes are more common. This is because the finest blood vessels run through the fingertips, so if you think about it that way, it's easy to remember. The nerves are damaged, so the sensation becomes dull. Therefore, you may not notice things like scratches or burns on your feet. And then, if you leave skin damage untreated, it becomes easier to get a bacterial infection. Therefore, as I mentioned at the beginning, the reason why people with diabetes are more prone to getting athlete's foot or bacterial infections is related to this nerve damage. Therefore, if you or someone around you has not noticed a shoe rub, or if there are many injuries on the foot, it might be a dangerous sign of diabetes. If you don't pay attention to foot injuries, you might not notice until it's too late. So please be aware. And finally, due to the fact that insulin, which is said to be the end result of diabetes, is no longer secreted at all. This is a symptom that occurs when the effectiveness of insulin is poor and the pancreas is strained to produce too much of its own insulin. I will introduce two dangerous symptoms. One is weight loss due to a decrease in insulin. You might think that diabetes is a disease that makes you gain weight, but that's not the case. Certainly, there are many people who develop diabetes due to dietary habits, and many people think that diabetes equals weight gain. However, as diabetes progresses, your weight will continue to decrease. Why is that? Well, let's start with the structure of diabetes. Insulin is a hormone that converts sugar into energy. If insulin is not produced at all, even if you take in a lot of sugar, it cannot be converted into energy. So even if you eat, you cannot gain nutrition, and the energy necessary for living cannot be converted from what you eat, so we use our muscles and fat. By doing so, we manage to survive, so when diabetes progresses, our muscles and fat waste away and our weight decreases. And the second symptom caused by diabetes is cancer, which occurs when insulin function deteriorates and too much insulin is produced. The cause of diabetes is the deterioration of insulin function, and it's producing insulin. The pancreas is a vital organ, but obesity can lead to diabetes. This is because the function of insulin, which is produced by the pancreas, deteriorates. The human body, when its insulin function is poor, is forced to produce more and more insulin. This overproduction of insulin is thought to be linked to the risk of cancer. I mentioned earlier that weight loss occurs in diabetes, but if you develop cancer along with diabetes, the malignant tumor will grow larger and larger, consuming the nutrients in the human body, leading to further weight loss. And as the cancer continues to grow, Your body may feel unwell, you may feel fatigued, your appetite may decrease, and your weight may decrease. Regardless, if your weight has decreased by more than 1 kilogram in a month without any effort, please consider seeing a doctor. If you develop cancer, your blood sugar levels will rise sharply. This is called pancreatic cancer. The pancreas is an organ that produces insulin, and if a malignant tumor develops in the pancreas, it can't produce insulin properly, which can cause your blood sugar levels to rise sharply. So even if you've been eating normally, taking your medication, and controlling your blood sugar levels may suddenly start to rise without any changes in your lifestyle. In these situations, doctors will watch carefully for malignant tumors, especially pancreatic cancer. If your blood sugar levels are rising rapidly even though you haven't changed your diet or medication, please consult a doctor. How does that sound? This time, we discussed the mechanisms leading to diabetes and the dangerous symptoms of diabetes. We explained that, including the reasons. If you've had experiences like, "This happened to me," or "I did this and my blood sugar levels dropped," or other significant events, please share them in the comments. Sharing everyone's knowledge and contributing to everyone's learning would be great. Thank you for watching this lengthy video to the end. In this information age, knowledge is power. Going forward, let's not simply fear diseases. We'll keep explaining clearly, using data to show why these symptoms happen and this treatment works. I hope we can learn together to avoid misinformation. Let's review. Diabetes is caused by factors such as diet and genetics, which make insulin less effective. Insulin converts sugar into energy, reducing the amount of sugar and lowering blood sugar levels. Due to high blood sugar levels, I mentioned 3 symptoms. Your skin may become dry, your immunity may decrease, and your throat may become dry. You may also need to use the bathroom more frequently. I also explained the complications caused by diabetes, which may include difficulty seeing. I explained the symptoms of numbness in the extremities and decreased sensation. As a result of diabetes, insulin levels decrease and body weight decreases in reverse. Overproduction of insulin can increase the risk of cancer, and I introduced such things. Whether the rating is good or bad, it's a learning experience. From tomorrow, we'll continue sharing easy to understand health knowledge from an active doctor's perspective. I'd be happy if you could subscribe to the channel. Let's meet again in the next video.